Welcome to the Spear Open Wide Foundation Volunteer Orientation. I'd like to begin by saying we are so excited you have a fast approaching service trip at the Open Wide Permanent Dental Clinic located in PERONIA, Guatemala. Thank you so much for being a part of the group of dentists, professionals, and family members contributing their time and skills at clinics built in collaboration with the communities they serve. You will be joining the clinic's permanent dental team who will help support your week of service. Together, you'll impact the oral health of the local community for generations to come by providing restorative dentistry, caries prevention, and oral health education. Before we get started, I'd like to share with you that the orientation is approximately 30 minutes. We are very happy to schedule a follow-up call with you after the orientation video to cover any unanswered questions. You also have the option of scheduling the orientation in person with our staff. To schedule, please call 855-843-8444. A printable version of this presentation is available on the Volunteer Resources page of the Open Wide website, and many of its details are also included in the clinical preparation guide we'll email you for you to print and review on your way to Guatemala. You may want to have a piece of paper and pen to write down any questions for follow-up after the orientation. Okay, let's begin. As an overview, we'll cover both the travel portion of your trip, like your arrival in Guatemala City and the city of Antigua, which is where you'll be staying, and the clinical portion of your trip, including a schedule for the week, an introduction to the PERONIA staff, our clinical setup, the triage and workflow systems that we use, our charting and statistics gathering, as well as suggestions by other volunteers about capturing memories during your trip. The Aurora International Airport is a very easy airport to navigate. They have only one international terminal. As you get off the plane, you'll go up a handicap ramp and reach the long glass-enclosed hallway pictured to the right. When you reach the hallway, go all the way down it and continue until you see two escalators that will take you to the main level. There, you'll reach the first of the three stations that you'll go to before you exit, the first being immigration. At immigration, please hand your passport to the immigration officer. They'll stamp you into country and wave you to the left. Just around the corner of the separator wall, you'll see the baggage conveyor belts. Pick up your bags, and as you turn away from the baggage area, you're looking directly at the customs line. We have groups that go down year-round, so even the staff at customs is familiar with our foundation. When you hand them the customs form, please say the words "open wide," and they'll know you're there with a dental outreach. The blue and white customs form is provided for you when you're on the plane. What you'll want to do is have filled it out with your personal information and mark that you were there as a tourist. Anyone staying in Guatemala less than 90 days is considered a tourist. Once your bags go through the X-ray scan, you're only about 50 steps away from the main exit doors. As you go out those doors, you'll notice that there's a half-wall median behind which everyone who's picking up someone from the airport stands. Your Maya Sky tour driver will be there in a Maya Sky shirt with a piece of paper that says the words Open Wide Foundation and your name. They're also typically saying the words open wide as people are coming out of the airport from your plane, so it's easy for you to meet eyes. When you do, please meet them around the half wall. They'll help get your baggage and load it to the transport vehicle, and from there you're approximately 1 hour away from your hotel in Antigua. For the commute, half of it is in-city driving and the other half a little more rural. You'll notice that you've hit the city of Antigua, when the road gets a little bumpy because of their traditional cobblestone streets. From that point, you're only about 5 to 7 minutes away from your hotel. Next, let's talk a little bit about Antigua, where you'll be staying. Antigua is an UNESCO World Heritage Site. It's a 400-year-old Spanish colonial city that's really been kept to the architectural confines of the Spanish colonial style. It's all built off of this main central park, or Parque Central, and everything is typically within about 5 to 6 blocks of that main central park. It is the top tourist town in Guatemala because of its great variety of activities and things to do. They have amazing restaurants, shopping, historical sites, even a chocolate factory where you can make your own chocolate bars, and a jade museum, as well as a nearby zip line and coffee plantation. Maya Sky Tour Company also offers cultural tours. There are half-day tours like walking around Antigua with a guide, or even making a hike up the famous Pacaya volcano. And one-day tours, including Lake Atitlan, which was recently voted the #1 most beautiful lake in the world by National Geographic, or even the Chichicastenango Mayan Market. To share with you a little bit about the travel tips and details, the temperature in Guatemala is going to range between 60 and 85 degrees Fahrenheit. Your cell phone will work very well on the local systems. You need to turn on international calling. Those rates do vary by provider, so check with your provider. And just to let you know, we also have local track phones that are pay by the minute that can be loaded with additional minutes at any pharmacy within Antigua. The electricity is the same as the United States and Canada, so no transformers are needed. You can plug in anywhere, and there's no risk of you having your the electricity fry your electronic devices. For local currency needs, the local currency is a quetzal. Now, if you're staying in Antigua, 95 to 98% of your purchases can be made by your credit card, including Visa, MasterCard, American Express, or Discover. If you are going to be mostly staying in Antigua, you'll likely want to only exchange around $100 into quetzals. And if you're going outside of the Antigua area, for example, to the market, the main Mayan market, you'll want to exchange as much money as you'd like to take for your shopping trip. Quetzals can be obtained by either going to your local bank ahead of time. It normally takes approximately 7 days to receive quetzals by your bank. You can also exchange cash US dollars at your outgoing airport hub at the cash exchange booth, or there are a couple of cash exchange booths in the Guatemala City Airport. As well, Antigua has multiple banks, mostly concentrated around that Central Park area, where there are ATMs and exchange booths. Tipping is also a little different in Guatemala in that their customary restaurant tip is only 10%, and it's often included in the bill. When you receive your receipt, you'll see your individual items, a total, and then a line called Propina, P-R-O-P-I-N-A. And on that line, it will either be empty, you write in a 10% tip, sign and go, or you'll see that it's filled in with the 10% of the total bill, and at that point you just sign the receipt and go. We also hold off on giving tips at every drop-off pickup from the Maya Sky Tour Company. Instead, we'll typically do one group tip at the end of the week, typically ranging between $30 to $50, and normally done on that last day of clinic on Thursday. Some international travel tips that we always like to share are, please don't take any public transportation. That includes chicken buses or even the little motorcycle tuk-tuks that are around Antigua. This is for safety reasons. For example, the motorcycle tuk-tuks are on the streets of Antigua, which are a little uneven because they're cobblestone, and we've heard of them toppling over when it rains. So just for your own safety, please don't take that public transportation. If you'd like to have a taxi, feel free, but do have the institution that you're at, whether it's the hotel or a restaurant or a shop. Call one of their safe drivers on their list of taxi drivers. You'll keep your passport and valuables locked in your room. Each room typically has a safe where you'd put your passport and valuables. I would suggest that you take 3 copies of your passport, 1 for each of your check bags, and 1 to have in your purse or wallet. While traveling inside Antigua and inside Guatemala, you'll only need your driver's license and a copy of your passport. Please walk in groups of 2 or more if you can. This is especially true towards the end of the day as shops and restaurants are closing between 9:30 and 10 o'clock at night. Keep your higher denominations of money separate and tucked away, and this is especially true if you are going to one of the local markets. In a market environment, it tends to be quite congested, and you'll want to keep your money a little closer to the chest. Other than that, walking around Antigua, you can feel very comfortable. It's less than 1% crime, very concentrated on tourism, and it's a very safe place to visit. Lastly, keep the local address and numbers with you. When you receive the clinical preparation guide, one of the first pages is your list of contacts for the trip, including telephone numbers for Maya Sky, our team here in the United States, the local board of director who's available to you 24/7 while you're in Guatemala, the local director of the clinic, Stephanie, everyone who is there to support you during your week of service. If you'll simply write the local address, your hotel name, and the number on that piece of paper and take it with you, you'll have the numbers with you at all times. Next, let's cover the clinic setup and systems. Your schedule for the week is going to be a 7 a.m. breakfast each morning. At 8 a.m., the bus will leave the hotel for the clinic. And at 9 a.m., you'll arrive at the clinic and have start of day. We typically have lunch between 12 and 1. We have a professor of local culinary arts who teaches traditional Guatemalan-style food, made family buffet style, to her students in the county kitchens each morning during your volunteer trip, and sends it fresh from the kitchens over for your lunch, and it typically arrives somewhere between 11:30 and noon. Lunch is discretionary how you spend it. You can either go have a meal and head back to clinic to see more patients, or you're welcome to take the full hour, sit and enjoy getting to know the local staff, students, or simply enjoy your group of friends and family that are with you. At 3 p.m., we tend to start end-of-day wrap-up and seeing last patients. And then between 3:30 and 4, you'll be getting in the bus and leaving for Antigua. From the town of PERONIA, you have to follow the same road that includes outgoing traffic from Guatemala on your way back to Antigua. So please be sure to leave by 4 or you may get caught in extra traffic on your way back. You'll arrive at the hotel approximately at 5 p.m. and evenings are free. Next, I'd like to describe a little bit about the open-wide partnerships and the full program, what we're doing nationally there in Guatemala. The Spear Open Wide Foundation does volunteer trips for people like yourself that'll typically go down for a 1-week volunteer trip. We use your donation to purchase dental supplies, maintain and replace equipment, and make sure that all things are running well with the program. We also provide administrative training and support to the local teams, and educational content and access for local university students as well as practitioners. We partner together with local counties. Villanueva was the first county that we partnered with, and they are the county where PERONIA is located. They provide the full local permanent dental staff to be trained, and now that they're self-administered for the full administration of the clinic, they also provide 24-hour-a-day, 7-day-a-week facility security and receive the land as a donation to the county. They help build the building and provided all the building maintenance from the day that the clinic opened. We also work together with private dental universities locally. We have a 2-month dental resident program which allows all final year dental students to have mentorship and training at the Open Wide Clinic, and advanced dentistry lectures are provided to the students and faculty at the university. The public dental university has a similar program. Their dental degree requires that they give a year back of public service, and these 10-month dental residents provide service in public clinics, not only at the PERONIA clinic, but at each of the Open Wide clinics throughout the country. We also work with the National Ministry of Health. In a collaborative initiative, we work together for promoting better oral health throughout Guatemala. One of the main areas of that initiative is our oral health education public service announcement campaigns. We provide this to both the national and local municipalities. It includes an array of television-ready public service announcements, as well as print materials promoting oral health, including brochures and educational information and posters to be given at local healthcare clinics. We also have an oral health outreach into local schools that occurs regularly throughout the year from Open Wide clinics, where oral health care talks, instruction on home health care, posters being placed in the lavatories at the schools, fluoride washes, and an all-around focus on oral health within the school. Next, let me introduce you to the dentists and team that will be providing support during your week of service. First is Dr. Stephanie Lambour. She's our clinic director and works for the municipality of Villanueva. She's a Guatemalan dentist who oversees all the permanent clinics for the county. She also oversees the volunteer programs within Guatemala and both the public and private resident dental student programs. Next, I'd like to introduce you to Rodrigo Davila. Rodrigo is a pediatric and special care dentistry specialist. The two of them are highly English-speaking, absolutely love working with volunteer groups, and will be a great support system for you during the week of service. You'll also meet our two general dentists, Dr. Barbie and Dr. Pablo, who provide services throughout the weeks that volunteers are not there. The next member of the team is Vivian. Vivian is our main dental assistant. She'll do your physical clinic orientation, your first day of clinic, help with translation and post-op instructions, as well as she's absolutely the point person for inventory, instruments, and supplies. Next is Lydia. Lydia is our sterilization tech and also does the local housekeeping. And finally, Syra, who's our front desk manager. She manages patient flow, does appointments and receiving, does all the patient records, as well as collects the local fee of $1.50, collected by each patient regardless of the service that they're provided. We also have county officers that are stationed on site. They're very much like firefighters in that they live at the clinic for 3 days and are off 4. Please feel free to let them know about any security needs that you may have. Next, I'd like to walk you through the actual clinical installation, the setup of the clinics. When you first arrive, you'll arrive and see the administrative building first. Those 2 front doors walk right into a patient waiting area, and just to the left of the patient waiting area is where Syra sits in receiving, and beyond her, a door that goes back to the lunchroom. As you exit the administrative building, the next building you see is the lavatories building. The patient lavatories are on the administrative building side, and the clinical lavatories on the clinic building side. On the back of that building is where we have our patient oral health education stations. They have sinks and mirrors where we provide home health care packages, oral health care instruction, and use even the dye to show people how to brush their teeth and get the plaque all the way off their teeth. Next is the clinical building. And there you can see there are 5 operatories. This is actually a picture of operatory number 5. And just behind it, an example of the cabinets that are in each of the 4 corners of the clinic. This happens to be the one for volunteer bags. In the other corner near chair number 5, we have prophy, treasure chest items, and endo instruments. Behind chairs 4 and 5 are the restorative cabinetry. Behind chairs 2 and 3, the sterilization unit. And over by chair number 1, which is typically our triage chair, is a Nomad digital x-ray system that takes x-rays by patient last name into EagleSoft. Then in the far corners near the x-ray and chair number 1 are the infection control cabinet and disposables cabinet. And this is what the clinic looks like when you're standing by chair number 1 looking across. Here's a little closer look at the operatories. And I always like to mention, when we went as a foundation to the dental industry and said that we wanted to really build a clinic that had brand new state-of-the-art equipment, the generosity that we received back was tremendous. The PERONIA clinic is actually the highest technology public clinic in all of Central America and receives tours from municipalities throughout Guatemala, throughout Central America, and even other countries who come in to see the technology at work in the local community, as well as meet with the local team about how this public clinic works. Here's an example of the types of things that you would expect to see in the restorative cabinetry. It's the only cabinetry in the clinic that has open faces, and as you can see on the actual cabinets themselves, they have labels. And when you open up the cabinets, it also has shelves, and the shelves have labels separating out the different types of items that are available for restorations. Here's an example of the amount of stock that we have in infection control and disposables. Feel free to use anything from the cabinets that you need to set up your operatories. Next, we also have an EpiPen, nitrolingual, oxygen monitor, and sugar glucose tester for your use in the clinic. As it pertains to medications, we do tend to have ibuprofen. It's often donated and at the clinic. You simply write down what should be taken on the prescription pad, and at the front desk, Syra will go over and dispense the ibuprofen and give directions. Same with antibiotics. Those will also be written out in a subscription pad, and the antibiotics are available over the counter at any local pharmacy and are very inexpensive. If someone's unable to purchase their own antibiotics, Syra can refer them to the municipal pharmacy who will provide it to them for free. For prescriptions, please have any of the local doctors write a prescription for anything stronger that's needed for a patient other than ibuprofen or acetaminophen. We have 3 main trays that are preloaded and in the sterilization unit: an exam basic, restorative, and extraction tray. The trays are kept to the left of the sterilization unit. All dirty trays go into the red light area, and all other instruments or specialty items are stored in the sterilization unit drawers below. We remove these items by using the sterile tweezers to select the instruments that are needed to set up for your operatory. Some items have very specific needs or wants due to preference on things like burrs, a particular brand of gloves, specialty instruments that have to do with their own specialty, or a particular composite that they're very partial to. Although we do have multiple types of composites and systems, we are fully stocked in gloves. Some people do bring those simply because of for their ease of use during the week. I've often gotten the question, are there any other things you go through very often that we could bring if we wanted to do something other than our donation? Here are the 4 things that we go through the most often, and they're always welcome at the clinic. Each operatory has a team table with these basics on it. As well, you'll have a team basket where you can put any specialty instruments from the supply cabinets. On your first day, Vivian will give you a physical clinic orientation. It'll take about 25 to 30 minutes. Then you'll get any specialty items, get your operatory set up to see first patients, and you'll be starting to see patients by about 9:45. In the clinic, we typically use a triage system where a dentist or an assistant will diagnose the patient, chart all decay, numb the area of greatest need, and then reseat the patient in the triage area between the 2 buildings as featured here in the left. Then they'll see their next patient, and a restorative team will get the triage patient, review the chart, and concur with or change the recommendation. Do feel free to do for this patient what you would do for them if you were in your own clinic. If you'd like to expand the services that are given, simply let one of the staff members know that you'd like how much time you'd like to spend with them and what you'll be doing, and they'll be able to easily adjust patient flow. Then, of course, perform the treatment, chart the work that you've done, make your notes for next visit recommendations and timing, and then have someone assist you in communicating any post-treatment care to the patient. You'll typically have either a dental student and or a chairside assistant, or you can ask one of the local staff members to help you communicate with the patient and make sure everything is clear. There are times of day when there are not triage patients built up, like first time in the morning or just after lunch. At that point, everyone grabs a non-triage patient, goes all the way through the steps with them, and by then triage is built back up again. Our patient charting system has 3 pages that you'll be dealing with. First, the chart is set up in both English and Spanish completely. You'll notice that the very first section is the patient general information section. Next is their medical history. Next, the dental information and history. Then a patient checklist of all the services that they've received in the clinic. And lastly, a prevention and education log where we mark all of the fluoride washes, varnishes, instruction, and what their next steps may be. The second page of the chart is a tooth chart. At the top, you'll notice that there are 2 boxes, one in English and Spanish, showing our coloring directions. The chart is a dual numbering tooth system, both the US system and Canadian system, as well as has the periodontal marking sections. We also have a pediatric tooth chart and an area for diagnosis notes. The third and final page you'll be dealing with are the patient services provided. First, the section for treatment planning. Next, the services delivered and notes. And finally, a root canal treatment log. We also provide 1 piece of paper for each operatory each day. It looks just like this, and it's pre-date stamped. And what you'll want to do is fill in the doctor name presiding over the chair and all assistants' names. This could be 1, 2, or even 3 assistants. What we'll be collecting from each patient chart is the name of the patient, whether they're a male or a female, an adult or a child, and how many of what treatment was provided. At the end of the day, the doctor will sign at the bottom and hand that to any of the staff members who will get it to the front office, who then compiles those statistics on a weekly basis and provides them to ourselves, to the local municipality, and to the national statistics gatherers. Lastly, I'd really like to tell you a little bit about suggestions from other volunteers about making memories. I want to make sure to remind you to please take the time throughout the week to take time for photos. Make sure that your camera or your phone has enough space for taking a lot of photos. You can do before and after with patients, with the students and the staff inside the clinic, a group photo in front of the clinic. Please make sure to give your phone or camera to someone in the clinic and ask them to take pictures of you while you're working. While you're around Antigua and on any tours, you'll have many, many opportunities to take pictures of this very unique and wonderful place to visit. And the very last thing is we want to tell you how grateful we are that you're coming to the clinic. I know you'll really enjoy your trip. You'll enjoy working with the local staff, the clinical experience, as well as the travel experience of just being in Antigua and in Guatemala. We can't thank you enough for joining us. And please either call us with any follow-up questions that you may have or call on us for support at any point between now and your departure for your trip. Thank you so much, and we hope you have a wonderful rest of your day.